Welcome to East-West Medicine, where we discuss health topics with practitioners and experts from diverse backgrounds around the globe. I'm your host, Dr. Eric Grasser, specialist in family medicine, functional medicine, and Ayurveda. The information on this show is not to be taken as health advice. If you have a health concern, please contact your health provider. Welcome to East-West Medicine. I'm your host, Dr. Eric Grasser. I'm excited to have on the show this evening Dr. Mark Vinick. Dr. Mark is a doctor of chiropractic with a degree from the Los Angeles College of Chiropractic, as well as a clinical Ayurvedic specialist, trained at the California College of Ayurveda, graduating in 2004. He has a private practice in Redondo Beach, California, where he's been a longtime Ayurveda practitioner and has served the Ayurveda community over the years in various capacities, including being the director of the California Association of Ayurvedic Medicine for over 10 years. Welcome, Mark.
Oh, thank you, Dr. Eric. I'm glad to be here.
So, Mark, tell us a little bit about how you got into Ayurveda and maybe touch on the trend now for chiropractic physicians to incorporate other modalities into their practice besides traditional chiropractic.
Oh, I first heard the term Ayurveda probably 35, 40 years ago when I was studying in Europe with the meditation teacher Maharishi Mahesh Yogi. He spoke about Ayurveda, and from what my experience was up at that time in Vedic knowledge, I knew if it was Vedic, it had to be profound and true and useful. The challenge was there really wasn't anywhere to study Ayurveda. And so I think before I started chiropractic school, Dr. Vasant Lad published a book, also Robert Svoboda, Dr. Svoboda, published some material on Ayurveda, and I read those, but there really wasn't any avenue for gaining any further information. So probably about 20 years ago, I took a couple of programs with Maharishi Ayurveda. I did David Frawley's home study program, taught that out of my office with about 8 health professionals. They took the class and I taught it. I learned best by teaching. And I think in the year 2000, I enrolled at the California College of Ayurveda and completed their program as a clinical Ayurvedic specialist. Before that, though, I started studying with Vaidya R.K. Mishra, whom I consider my foremost long-standing teacher. And I pretty much follow his specific avenue in Ayurveda, the SVA, the SVA Ayurvedic tradition.
So, did you go to chiropractic school then as a means to kind of incorporate Ayurvedic knowledge into a practice that maybe had a more established licensure in America?
Well, when I was working on those Transcendental Meditation teacher training programs, I worked as a medical assistant and I did massage. And I realized I was pretty good with hands-on healing. And I kind of have a very inquisitive nature, always wanting to learn more and more. So I actually, it was a pet peeve. I actually couldn't stand it if I felt someone else knew more than I did about an area that I was interested in.
Yeah.
And so I decided, well, what avenue can I go into? So I figured probably chiropractic would be the best to be able to use my hands as a healing modality.
And I'm just curious, when you were in chiropractic school in Los Angeles, graduating in 87, I mean, was the chiropractic curriculum fairly traditional in that they were teaching with a heavy focus on anatomy and musculoskeletal disorders and manipulation, or had they already penetrated into chiropractic education a lot with nutrition and functional medicine, supplementation, the kind of things that it seems like chiropractors who are graduating now are coming out with?
Basically, the I think the curriculum is pretty much the same. It's basically medical education, pretty much the same amount of hours, same textbooks, same national board licensing exams are basically the same tests as they take in medical school. The difference is rather than surgery and pharmacology, we learn nutrition and manipulation of the spine and extremities.
And do you still do traditional chiropractic manipulation in your practice?
I do, although I prefer a specific non-force called Impulse IQ. It's an instrument. It's pretty state-of-the-art manual instrument adjusting technique. I prefer that. It seems to be more specific, more exact. It's more comfortable for the patients, and it also works on soft tissue. But I do both. Some people in some conditions probably prefer the more traditional. But most of my chiropractic work is instrument non-force adjusting.
And what are some of the conditions you see a lot of?
As a chiropractor, pain is a highly motivating factor.
Yeah.
And I would say the vast majority of my patients are in pain. It's once in a blue moon, someone will come in and say, well, I'm used to chiropractic care. I don't have any complaints. I like to just maintain the integrity and functioning of my spine and nervous system. And I just moved here from out of town, so I'm looking for a chiropractor. But that happens, but it's rare. Most of the time, pain, headaches, neck pain, mid-back pain, low back pain, radiating pain, the upper extremities, lower extremities, sciatica, sport injuries. From a chiropractic perspective, but from an Ayurvedic perspective, I can pretty much treat any individual with any condition. May not result in a complete cure or healing, but certainly there's almost always an improvement.
I'm wondering, do you find in chiropractic, I mean, since you deal with so much pain, neck pain, back pain, etc., and I'm sure you would agree with me in that it's often very difficult to, tell the patient that there's one specific condition occurring that's causing their pain. How do you navigate that with the patient that, the patient comes in saying, I want to know what's wrong. Is it a slip disc? Is it a sciatica? Is it arthritis? And yet we as practitioners who understand spinal disease, I think, realize that you can't always really tell exactly what's going on, but you may be able to help the person functionally. So how do you navigate that fact that the patient wants this specific definitive diagnosis, whereas as we know, Ayurveda says not every disease is named and it doesn't always matter what you call it. It just matters how you address it.
Yeah, you're exactly right, Eric. People want to know specifically what's going on. And as a licensed health professional, we need to have at least a differential diagnosis. I pride myself in doing a really thorough initial physical exam. And I would say almost always I have a pretty good idea, a pretty strong suspicion as to what exactly is creating their problem. Occasionally, I may not know specifically. Is it a facet syndrome? Is it a disc lesion? Oftentimes the thorough exam will differentiate between those. Occasionally, I'll just give a differential diagnosis and say, well, I think it's this specific problem, but without further x-rays or diagnostic studies, an MRI or a CT scan, I'd have to give a differential. I say, but it could be this, could be this, it could be this. Most of the time, they're non-surgical cases, and that being so, I'm going to treat them the same anyway.
Yeah.
And so that's my approach. So I come up with a diagnosis or a differential diagnosis, which means a couple different possibilities. Could be this, or it could be that, or it could be that. And I treat them, and then I give a specific period of time, and it's usually within a week or two. I like to see at least some significant improvement. And if it's not the case, then we may want to send out, do some other testing. That happens, but not very often.
So do you feel like you can operate then? Let's just take back pain because it's probably the most common thing you see, and it's one of the most common things that people come to a family doctor for, like me. With back pain, do you actually feel as though a lot of the time you can work at the structural level, and if you and that there may be one unifying diagnosis that's the cause of their pain, and that if you address it, they can get better? Or do you feel like with back pain, there's so much going on at once, that you have to address it at multiple levels, including then going down into the more subtle levels like the psychospiritual aspects of pain?
That's a complex question.
Yeah.
Usually someone comes in and I do an exam, and almost always I'll determine there's some joint dysfunction. In other words, that vertebra is not moving the way it was intended to move. And once that's diagnosed, then I'll treat that with chiropractic. And most of the time their symptoms improve. There may be some nerve impingement, there may be some disc herniation or bulging. Nonetheless, usually treating them, they get better. If they come in with specific complaints of pain, and I do my exam and I cannot reproduce that pain, if that joint appears to be functioning, if I think it's coming from the low back and the low back vertebra are moving normally and nothing in the exam reproduces the pain, that's a red flag. And I may treat them at that time. And if there's completely no improvement at all, that's happened only a few times in my 30 years of practice, and I've referred those people out immediately.
Yeah.
And they had other issues going on, and they were grateful for the quick referral. They were able to be addressed with surgery.
So do you feel like, so much of the time that actually working on the joints, can actually be an improvement, and how much is there a downstream effect where, muscles are involved, fascia is involved, ligaments are involved? It seems just to me like back pain is not that simple, especially because we go and get MRIs on a lot of people, at least I do. And you can't tell whose MRI is the person in pain and whose MRI is the person that's not in pain. If you switched them up, you wouldn't really be able to tell.
You're absolutely right. In fact, studies have shown that basically if you pick random out of the population, people with no back pain, 30% of those individuals who are asymptomatic, having no back pain at all, 30% of them will show a minimal disc herniation. Whereas I've seen people with disc herniations and have no symptoms and be pain-free.
Yeah. But it sounds like there's often room for you to work just with the facet joints and with the mostly the facet joints, I guess. If there's stiffness there or hypomobility, and getting those things to move, and that can actually help, even if the condition is more of a nerve impingement or something like that.
And the facet joints can refer.
Yeah.
They can refer pain. And in my experience, 30 years of experience, it's mostly the joint dysfunction, the facet syndrome, that's creating the person's symptoms. And that creates inflammation, and that inflammation can exacerbate the nerve root and create change the chemistry in the area and create a radicular pain like a sciatica, which is chemically induced because of the inflammation due to the proper motion of that joint. But most of the time, we have superficial muscles, the large muscles on the surface of the body, that get addressed when one gets a massage, even a deep tissue massage. But the vertebra, the muscles that cause the joint dysfunction are very, very small muscles, very deep. They're actually the intrinsic muscles of the spine. They go from the spine, perhaps a half an inch long. They go from the spinous process to the spinous, from the transverse to the transverse, or from the spinous to the transverse. These are very small muscles, and massage doesn't affect those. The chiropractic manipulation, whether you're doing it by hand or with an instrument, does release those muscles and allow the vertebra to move more in its proper range of motion.
Fantastic. We are visiting with Dr. Mark Vinick, Doctor of Chiropractic and Clinical Ayurvedic Specialist. Stay with us. Welcome back to East West Medicine, KSFR 101.1 FM, Santa Fe, New Mexico, streaming live at ksfr.org. All of our podcasts are available at eastwestmedicine.libsyn, that's libsyn.com. And Mark is not only a chiropractor, and we were talking a lot about back pain before the break, but also has decades of experience studying the Vedas. These are the ancient knowledge systems out of modern-day India, including Ayurveda, which is the science or knowledge of life, and often referred to as a sister science of yoga. I was wondering for your take, Mark, on what's happened with Ayurveda in the West. You've been involved in the Ayurveda community much longer than I have, although we do have a lot of colleagues in common, and it seems like there is such a booming interest in the Vedic sciences and in Ayurveda, which I've sort of said for the last 10 years is riding the coattails of yoga's popularity. But with that, you have a westernization, or some would even say a bastardization of the ancient science. And, how do you see that trend affecting your practice? With what do people come in and bring to the table that you have to kind of work with or undo?
Yeah, that's very true, Eric. I kind of have a joke. I talk about yoga, and then I talk about California yoga.
Yeah.
Someone would watch a video in the early days. I know someone would watch a video, Jane Fonda video. They'd learn a few asanas, and then they were teaching.
Yeah.
Fortunately, that's not the case so much anymore. People are a lot more astute and sophisticated, and there's a lot more sophistication in yoga teacher training. The same is occurring in Ayurveda. The original programs in India, the BAMS programs, those are 5-year medical programs. And here in the U.S., Dr. Vasant Lad was probably the first one teaching Ayurveda to the American population, but he was not creating practitioners. Basically, he was teaching for people's use with themselves and perhaps family members. One of his students, Dr. Mark Halpern, who was a chiropractor at the time, opened up a school in Nevada City, initially in Grass Valley, to adjoining areas. And he started training. He was the first one outside of India that started training Ayurvedic practitioners. And his program, it started off as a 500-hour program. And then I think he kind of started allowing people to get a diet and lifestyle certification at about 250 hours. The 500-hour program, he may have increased that now, but then he also offers a Ayurvedic practitioner program, and now his full CAS, Clinical Ayurvedic Specialist program, that's the degree I have from him. It's been expanded, and it's just under 2,000 hours now. But what I find, unfortunately, is once one studies any of the Vedic knowledges, any of the Vedic information, people oftentimes really identify with it, and they feel it's theirs. And because there's something so profound in this teaching that really inspires us to the depth of our being, people in their exuberance will start teaching and practicing, and oftentimes without a lot of depth of understanding. And that shows up a lot, and that can be an issue, where you get a lot of information that's probably, that's saying a little bit of information is a little bit of knowledge is a dangerous thing, and that's especially true, I believe, in Ayurveda. The good thing is, though, that these people they have the interest, and hopefully they're encouraged to further their studies. In fact, I'll probably admit my own guilt. When I first started practicing Ayurveda over 20 years ago, the recommendations I was giving then, which were just identifying their body type and imbalance and giving recommendations to Passa by Vata Pitta Kapha. My recommendations are far different now. They're a lot more specific for individuals. So I think within time, we'll see the scope of training and the scope of competence dramatically improve as Ayurveda becomes more and more in demand, and the demand for more education and better quality practitioners also happens simultaneously.
You know, I think that begs the question that a lot of us have been asking among ourselves is, is there a value in using a westernized version of Ayurveda, a simplified version of Ayurveda, Ayurvedic principles maybe, without really an understanding of Ayurvedic medicine, or how Ayurveda really looks at imbalance and disease, or is this dangerous, and are we really disrespecting the tradition, for example, by adopting a westernized version like a dosha-specific diet or something that may not really be part of the way Ayurveda was originally taught and how it's practiced in India?
That's a good point, Eric. There are specific general recommendations within Ayurveda, and I believe those can be presented safely as far as a general diet and lifestyle recommendation is. Keeping in mind that these are for individuals that don't have any health issues. That being said, most people have an imbalance. Most people are not within their body type. There's a tendency in Ayurveda to identify the body type and then to give recommendations based on the body type. And I believe that's an error. Basically, in Ayurveda, my understanding, my training, Chak Samhita, the text, they basically specify you have to identify, you want to know what the person's underlying body type is, their dosha, their property, their nature. But you also need to know if there's an imbalance. And if there is, that takes primary. That's what you treat first, is the imbalance. You also need to take into account the season that they're in. And in the back of your mind, you need to know what their nature is, their body type. But the most important is the imbalance. Secondly, the season. Third, the body type. So I don't know, I'm not exactly sure what a westernized approach to Ayurveda is, unless you mean by recommending a primarily Western diet based on Ayurvedic principles.
Well, I mean, mostly I mean the way in which Ayurveda is taught in the West, which is generally accepting the fact that the student is not committing to a 5-year course of study with access to all of the medicine making and the the panchakarma techniques, because it's just so difficult to teach that in a clinical setting here, because we just don't have enough patients undergoing those procedures, if you will. Whereas in India, there's just it's so much more commonplace for people to be undergoing the procedural treatments in Ayurveda, and the students can study at a hospital where they incorporate Ayurveda with Western allopathic medicine. So I think a lot of it is that students in the West, they don't really get the exposure. They get a theory, and they have some, and they don't often dive into the ancient texts so easily, in part due to the fact they don't understand Sanskrit, and also because they just don't have the length of study. So they're learning from either Westerners or native Indians who have come to the West, and so things get very simplified, in my opinion. But I guess that would lead me to another question for you, which would be, what modalities from Ayurveda, what techniques, what tips and tricks do you find do work that you can educate your patients on, that are easily digestible, given the fact that most of our patients are not going to be able to go ahead and go through deep treatments, or have the resources and the time to undergo the daily treatments that are commonplace in India?
Basically the dinacharya, the daily recommendations, the diet and the lifestyle recommendations, these are something that very easily can be applied to individuals in the West by someone with not that extensive training. Like, the 3 pillars of health in Ayurveda: sleep, diet, and activity. These are basically really important things that are pretty much abused and taken advantage of and not acknowledged in Western society. People are eating really poor diets, prepared diets, previously prepared in a factory, frozen. People take them home, microwave, eat them on the run. They eat leftovers 2-3 days old, eat a lot of processed, packaged, genetically modified foods. fresh food that's prepared fresh and eaten then. It has properties in it that enliven the body. In Ayurveda, we acknowledge different qualities, even in the food. Sattvic, Rajasic, and Tamasic, or intelligent food, dumb food, or dead food. The intelligent food is the freshest, best food that's prepared fresh. It's inherent with nature's intelligence, prana. And that provides the missing element in food that helps create our health and vitality. And that's what's missing with a lot of the processed foods, or people eat out a lot, and they miss out on that. The other thing is going to sleep early, going to sleep in the kapha time period, before 10 o'clock at night, 9 or so, and then getting up early with the sun or before the sun when the prana is so high, and vata dosha, that energy at that cycle time of the day enlivens the mind and the body with fresh, energetic, creative, and inspiring energy. And beginning our day at this time helps align our own internal biorhythms with these powerful and strengthening rhythms of nature. And this allows for a greater physical strength, energy, immunity, mental clarity, and peace of mind. These are really important principles. And so someone with a basic couple hundred hours training, the diet lifestyle person, can help people to create these. Because it's not just reading about it. People need a little coaching in order to actually be able to apply these. And applying these basic principles can make a big difference. But that being said, if someone has some significant health issue going on, they're going to, especially if they're taking Western meds, you just can't throw a bunch of herbs at them.
Right.
The practitioner needs to be extremely well trained and versed in dealing with Western pathologies in order to help the individual.
Well, thank you so much, Dr. Mark Vinick, for being with us on East West Medicine. You can find Dr. Vinick at drmarkvinick.com. That's drmarkvinick.com. If you want a consultation with him in the Los Angeles area, please call 310-375-4325. We'd love to have you back on the show. Dr. Mark, thanks for being with us.
Thank you, Eric. It's certainly my pleasure.
Thank you for listening to East West Medicine. The views expressed on this show do not necessarily reflect those of the host nor KSFR radio station. If you have any questions, comments, or feedback, please contact us at eastwestmedicine@ksfr.org. We would like to thank Desert Dwellers at desertdwellers.org for their music. Thank you for listening, and be well.